Welcome to Health Yeah, where experts from Stony Brook Medicine come together to discuss topics ranging from the complex inner workings of an infectious disease to tips and tricks for staying safe and healthy all year long.
Hello and welcome to our program. It is the new year and it's time for New Year's resolutions. A lot of us make them. Probably a few of us keep them, though. So we're going to talk with experts today a little bit about New Year's resolutions and some of the things that people can do to be healthier in the new year. And I have two experts joining me for the first part of the program, and I'd like, if we could, to get each of you to introduce yourself to our audience and tell us a little bit about what you do here at Stony Brook Medicine. And Dr. Spaniolas, you are directly next to me, so we will start with you.
I'm Dino Spaniolas. I'm a professor of surgery at Stony Brook University and the director of the Stony Brook Bariatric and Metabolic Weight Loss Center.
Great. And Joe Giglio is right over to the right of Dr. Spaniolas. Joe, tell us a little bit about what you do here.
Hi, thank you for having me. I am the supervisor of physical and occupational therapy. I supervise the inpatient and outpatient clinics. I've been here for 34 years. And I look forward to talking about exercise today.
34 years, so you're the new guy here then.
Yeah.
So tell us a little bit about, let's talk about weight loss first, because I think that's, to me, that's the logical thing that people think of when they are talking about New Year's resolutions. How does somebody start a weight loss program without feeling overwhelmed? Because I think oftentimes we maybe bite off more than we could chew, no pun intended.
Weight loss can be a complicated process, but it doesn't have to be. And we tell everyone start easy and baby steps at a time. And oftentimes that means things like food logging, keeping track of what you consume, counting your calories, and then keeping track of your physical activity. I'm sure Joe will talk to us a lot about that, but easy steps would be things like using a device or your smartphone, perhaps, to count your steps.
You know, one of the things that I think is a huge benefit to people that come and be part of an institution like Stony Brook, the multidisciplinary team. We can kind of cover you from start to finish, no matter what it is you're looking to do. And I think this is a perfect example of that.
It's exactly what you said, Tim. As patients start their approach to losing weight, we have an entire team, a multidisciplinary team, to help them along the way. And that includes things like nutritional counseling, exercise programs, and oftentimes using other modalities such as medications or other interventions to help them lose weight.
Joe, I want to give this question to you because I think, again, when we talk about New Year's resolutions, weight loss, exercise, those have to be the top two. And, you know, I would imagine a lot of people talk to you about that. How often should somebody exercise, first of all?
Well, the activity guidelines from the American Heart Association, 30 minutes a day, 5 times a week at a minimum. And I could tell you there's more evidence out there that even 6 and 7 days is probably better. I would just say before anyone starts to exercise, they should usually check with their physician because we want to make sure it's safe to start an exercise program.
You know, a lot of us have a job where we are driving a desk every day. We sit there behind that desk for 8 hours a day, so we don't get up very often. We don't get much exercise. So, and those years have passed, you know, since we've been very active. What would you tell a beginner that is looking to get back into exercising?
Like Dr. Spaniolas said, I would start small. Walking is something simple we all can do. Just at the desk, get up from your desk every hour, take a little walk. If you can get a desk where you can work standing up, break it up. Don't sit. Being sedentary doesn't burn calories, doesn't retain our muscle mass, and it just causes a whole bunch of problems if we don't move. We were meant to move.
So what are some realistic expectations for weight loss? I think, again, this is oftentimes something that we probably have these grand goals and maybe set ourselves up for failure.
So I would say there's no single mold of in terms of what someone would expect for weight loss. We know that there are different modalities that can achieve on average different targets of weight loss. And I think the key when we see patients who are looking for help to lose weight, the key from our end is to match their goals, their own characteristics to the modality that we have to get them there.
You know, a lot of times I think people start with weight loss and then they hit that plateau. And after they hit that plateau, they probably feel like, I'm done. I'm not going to lose any more weight. What would you advise to somebody in a situation like that?
What you described, Tim, is a very common scenario. And as you lose that initial weight, your body adapts to the new conditions that you use to lose that weight, whether it is reducing your calories or increasing your physical activity. So at that point, oftentimes switching what you do to improving your physical activity, focusing perhaps more on maintaining and building your muscle mass, or looking through the nutrients that you consume despite the low calories, those can be tricks to help you kind of jumpstart that machine again.
So, Joe, I'm going to go to you now because I think what Dr. Spaniolas just said makes a lot of sense. When people hit that plateau, but oftentimes because they just aren't doing the work, then on the back end, the exercise. So what would you suggest as far as a workout routine? What should somebody look to do?
I would look to do some activity that you like to do. If you like to walk, cycle, swim. And I would incorporate in my exercise program not only aerobic activities, but equally important, resistance training, lifting weights, using bands. And it doesn't necessarily need to be heavy weight to get benefit to keep our muscle mass. You want to keep your muscle mass as you age as much as possible, because even if you don't lose weight, keeping your muscle will let you function and stay mobile well into your later years.
I can already hear it now. People are watching or listening to this, and they're saying, oh, gosh, I've got to join a gym or something like that. That's not necessarily true, though. You can do a lot of this at home, right?
Absolutely. There's many different ways to exercise your heart and your muscles right at home.
Perfect. Sleep is an important part, I think, of just health in general, but it's also an important part of weight loss. Can you talk to us a little bit about that, sleep and stress, and how that impacts the body?
That's very true. Sleep is a crucial component of your overall health, but also as it pertains to weight loss, there is a lot of evidence that even for patients who consume the same calories and they are perhaps losing weight in that capacity, patients who sleep 4 to 5 hours versus ones who sleep 8 to 9 hours experience very different results. So maintaining that a good sleep pattern is really important for your overall health, but also for weight loss. Sleep apnea is another big one. We know that untreated sleep apnea makes weight loss more difficult.
Really?
So part of the process as we assess patients, we almost screen everyone for sleep apnea. And if that's a condition that they have and is untreated, getting treatment for sleep apnea can really help with their weight loss.
Now, I knew sleep apnea was something that could impact your health in a lot of different ways, but I had no idea that it also had that kind of an impact.
It has a significant impact on your weight and also on your cardiovascular risk. Stress is another big one. We know that patients who have very significant stressors in their lives, weight loss is more difficult. We often will collaborate with our mental health colleagues to help patients manage the level of the stress better when it comes to eating and lifestyle changes.
Oh, interesting. So a lot of seniors will probably watch this or listen to this, and they think, gosh, I need to up my game a little bit. What would you suggest to seniors?
That's a great point that you bring up, Tim. Exercise doesn't only affect your muscles and your heart, it affects your brain and your cognitive capacity. There's some evidence coming out that a good exercise program, and it doesn't need to be super intense, can increase our brain health, delay possibly dementia. So we exercise not only our muscles and our heart and our brain, but also we get other benefits, lower stress, less anxiety. So exercise has many different benefits, and we're still learning today. It keeps growing, the list, and there's few side effects.
So Dr. Spaniolas, one thing I have to bring up, you mentioned sleep hygiene, which I think is just so important to people in general. Electronic devices are such a challenge, I think, for people, particularly if they are, a lot of times people lay in bed, they'll look at their phones or whatever. That is not good sleep hygiene. And that probably doesn't help you in general, we probably need to get away from the devices a little bit, our phones and the like.
A very good way of seeing this is we need to avoid all devices when it's time to go to bed. You can read or you can use your devices before you go to bed, but once you get there, you really need to maintain that sleep hygiene, as you mentioned. It is important for our metabolism, it is important for weight loss, and it helps promote a healthy living.
We're about out of time for this segment, but I have a final question for you, Dr. Spaniolas. Talk to us about some of the advancements in weight management that we've seen recently, and because there are some great things happening in that area.
We have a lot of tools that we can use to help patients lose weight, whether it is medications that can now be very effective for several individuals. There are other interventions that we can use, sometimes surgery for patients with significant excess weight, especially when that weight is also linked with diabetes or heart disease. And we can see a dramatic improvement in weight loss with using all those advancements, and also improvements in cardiovascular risk and even longevity.
Again, as I said earlier, I think it's such a valuable resource to come to an institution like Stony Brook, because you do have all of these experts working together to help you attain your goals and be healthy. So, gentlemen, thank you. You did a wonderful job. Really appreciate you being on the program. We're going to take a break now. We'll come back with 2 more guests to talk to us a little bit more about New Year's resolutions and how to be happy and healthy in the new year. And welcome back. We have 2 more experts joining us to talk about the new year and the new you. And we're going to have each one of you introduce yourself to our audience and tell us a little bit about what you do here at Stony Brook Medicine. And Dr. Hsu, we'll start with you.
Yeah. Well, thanks for having me. I'm Dr. Kimberly Hsu. I'm a family medicine physician. I'm focusing on preventative care and education, and our practice is out in Mattituck.
Perfect. And Dr. Haughton?
Good afternoon. My name is Dr. Adrienne Haughton. I am the Director of Clinical and Cosmetic Dermatology in our Comac location, and my practice kind of spans the spectrum of healthy skincare, healthy hair, and just really trying to help patients rejuvenate and make themselves feel and look better.
Perfect. So you guys are going to be great on the program. We appreciate you being here. So, Dr. Hsu, I want to start with you a little bit and just talk about, some of the basics, I think, for self-care and what we should do for ourselves during the year. One of the things, we just need to get checkups regularly, right?
Absolutely. Health checkups are very important. We call this usually an annual wellness exam. Usually that really entails making sure that patients are up to date with their preventative care. We assess their overall health, as well as just make sure they have any concerns and that they can come to us and talk to us about. Usually these wellness checks really entails for the patient to come in, make sure they're up to date on their vaccinations, make sure they're up to date on their preventative care, as well as, going over blood work and doing a physical exam on them.
And vaccinations, we've been talking a lot about vaccinations for the past few years. It's still important, though, to be vaccinated for things like the flu and COVID, correct?
Absolutely. I would always recommend to my patients annually that they should get the COVID vaccination as well as the flu vaccination. Other vaccinations as an adult that we should be getting at least one time as an adult is the Tdap vaccination that covers for tetanus, diphtheria, and pertussis, and which is going around right now as well. For patients 50 or older, I really recommend doing the shingles vaccine. That's a 2-dose vaccine, also known as the Shingrix vaccine, usually taken about 2 to 6 months apart. And the last one I would recommend is definitely the pneumococcal vaccination as well.
And I tell you, the shingles vaccine, you don't want to get shingles.
No. I have plenty of patients who tell me that's not fun at all.
Yeah. So let's talk a little bit about skincare, because again, I think, when we're talking about the new year and the new you, that's something that people think about. And what are some of the environmental irritants that we need to be careful of when it comes to our skin?
Sure. So when I think about our skin, the most important thing is to make sure that you're wearing sunscreen every single day. So you want to wear a sunscreen that has UVA and beat protection, and regardless of skin type. So, for example, people of color often feel that they don't need sunscreen, and this is actually not true.
Yeah.
The average person of African descent has an SPF of 13. Therefore, the recommendation of 30 or higher is a universal recommendation for all people. And then as we start to think about environmental pollutants and things like that, some studies have shown that topical creams that have antioxidants such as vitamin C, as well as vitamin E and ferulic acid, actually have been shown to improve free radicals in this at the microscopic level of the skin. So we can actually see some improvement there. So really thinking about antioxidants when you're thinking about the environment is very important for your skin.
We were just talking about checkups, but it's important to do checkups with your dermatologist on a fairly regular basis too. And for some of us, on a very regular basis, I go every 3 months, and not everybody has to do that, but it's a good thing to go see your dermatologist.
Definitely true. So when you're looking at getting an annual total body skin exam to check all of your skin, at that time, your dermatologist will determine if you have any signs of sun damage, precancerous or cancerous lesions. For those patients who have a history of skin cancer, for example, basal cell carcinoma, which is the most common type of skin cancer, we recommend patients follow up every 6 months. People who had a history of melanoma have to follow up every 3 months. And then, so it just depends on the type of skin that you have. So it's definitely important for everybody to see a dermatologist for a full body skin exam, and then you and your dermatologist will determine how frequently you have to follow up after that.
I remember I'm old enough that unfortunately we were young and dumb, and we thought it's a good idea to go out and fry yourself in the sun, and now a lot of us are paying for that, and so it is very important to do that. It's just very important to see your physician in general. I think to kind of keep a baseline and keep healthy.
Absolutely, yeah.
So let's talk a little bit about preventative screenings, because I think that's particularly as you get a little older, that's a very important part of your, or should be a very important part of your health plan.
Yeah. I agree. At least annually, you should be checking in with your doctor to do these annual screenings. Diseases such as cancer, if they're caught early, they have better effective treatments and better outcomes if you do catch them early. So some of the screenings that I would recommend to patients, and I usually go over at the annual physical, the first one would be screening with a mammogram for breast cancer. That's super important, and I would recommend that for women starting at the age of 40. Usually this is screened every 1 to 2 years. The next one I would definitely recommend is for women ages 21 to 65, and that's screening for cervical cancer with a pap smear. Colon cancer screening is super important. Guidelines now recommend that patients ages 45 start screening with a screening colonoscopy every 10 years, or you can do a fecal test such as the Cologuard, which will be done every 3 years. Lung cancer is another cancer that we screen for, and we do that with a low-dose CT scan. Recommended guidelines say that patients ages 50 to 80 who have a 20-year packing smoke history or have quit within the last 15 years should be screened for that. And the last thing I usually screen for is osteoporosis, and that's done with a DEXA scan. And this is for usually women over the age of 65, or it can be screened earlier if they have risk factors.
So the screening for breast cancer and also colon cancer, the ages have changed in the past, I don't know,
absolutely
10 years or so.
Exactly. Colon cancer used to be screened at age 50, but it's now lowered to 45.
Yeah. Mm-hmm. So it's important to keep an eye on that, because, again, I think these are all conditions. If they're caught early, you have a much better chance of a positive outcome. Same thing with skin cancer. And again, I just, I haven't gone through this myself. I can't stress how important it is to see a physician, listen to that physician after you see them. I was in a situation where my daughter actually noticed something, and I'm glad I went to the doctor because it was fairly significant. So you got to do that.
You definitely do. I actually have a patient whose 4-year-old daughter knows her melanoma. She said, "Mommy, what's that boo-boo on your arm?" Right? So when you're looking at what we call the ABCDs of melanoma, we're looking for asymmetry from a line down the middle. It's different on both sides. B is for border. It's notched instead of round like a coin. C is for color. There's numerous colors in the same lesion. D is for diameter, which is 4 millimeters, or the size of a pencil eraser, and E is evolving. And then we actually just tell patients, look for what's called the ugly ducklings, right? So this little girl noticed that something looked different on her mother. So it's important that you check your skin about once a month, have your partner check your back or the back of your legs, and look for anything changing. And then as you recommended, seeing your dermatologist, you can determine a baseline. And oftentimes patients come in for one lesion that's not concerning, but then we as dermatologists see something else that they didn't notice that is concerning. So it is very important to follow up with your dermatologist, starting at least once a year and then going from there.
So we're going to stay on the topic of skincare. What are some routines that people can follow to really have better skin?
Sure. So we talked about before, sunscreen is the first thing that's very important for better skin. Then as we look for that, a lot of people are looking for anti-aging products. And so the number one recommendations are called retinoids. Retinoids are derived from vitamin A, and there have been decades worth of research to show that they improve cell turnover and also improve the dermis of the skin. So that's a great opportunity for people as well. Then as we age, we actually have to look at our skin and say, what can I do here? We actually see a lot of patients actually have bone reabsorption, descent of the subcutaneous fat pads, and then also they notice some dynamic and then static lines in their skin. For those patients, I actually recommend they consider medical procedures such as dermal fillers or some of the biostimulators to actually stimulate their own body to produce collagen. And these are all FDA-approved treatments that have really been shown to be effective in restoring patients' natural glowing skin and improving some of the loss of volume over time.
And that's all just outpatient?
These are things that are all done completely outpatient with minimal downtime, and also give patients just really sometimes a boost in confidence. I have a lot of patients who come in and say, you know what, I don't feel as good as I used to. Actually, with the pandemic, a lot of people say I'm looking at myself so close with these Zoom filters and I see that I have all these lines. So for some patients, a little toxin to relax those lines, the 11 lines between the brows and things like that can really be a big difference. But yes, it's outpatient, in and out of the office within an hour, and then just continue your daily lifestyle. And many patients say people don't even notice. They just know I look refreshed. And that's really what we want to do and a little bit more useful.
So on Zoom, I always click the box and I put it clear to the right and just I look like a blob on the screen. But, at least people can't see lines or wrinkles. Just kidding. Let me talk a little bit about, let's talk about the immune system and how to boost that during the winter. Because, again, I think it's time of year where people tend to get a little sick sometimes. Yeah. And what can people do to keep themselves healthier?
So nutrition is definitely really important when it comes to boosting your immune system. You want to make sure you're getting lots of fruits and vegetables, especially with fruits and vegetables that are rich in vitamin A, C, and E. Drinking lots of water is super important as well. You want to kind of flush out those toxins in your body. Minimizing the amount of alcohol you drink during the season. I know it's tough, but, definitely something I recommend. Sleep is super important. You got to get at least 7 to 9 hours of good sleep every night to help boost the immune system. Also, if you want to take supplements, I would recommend some vitamin D, vitamin C, and some zinc, and that usually helps with immunity as well.
I'm just going to ask you about vitamin D because this time of year, it seems like the sun's going down at 4 o'clock. And not that we want to be out in the sun a lot, but you do need some of that vitamin D. Yeah. So it helps to take the supplements?
Absolutely. I mean, vitamin D is an essential vitamin that we should all be taking, especially women postmenopausally. It helps with, bone health. So I would definitely recommend that.
Perfect. We are about out of time, but I do want to ask a quick question about specific foods that we can eat that would help our skin. I imagine probably what she just talked about would be part of it.
Sure. A lot of what she did recommend, we recommend in dermatology as well, right? There's new research that's very optimistic as far as taking collagen, that it may have some benefit in boosting the collagen in your skin. And then also looking at a lot of the antioxidants, right? So we talk about, again, those foods that are rich in antioxidants such as blueberries, green tea, even if you have dark chocolate with a high level of cocoa can be beneficial as well. Because what we're trying to do is we're trying to minimize the impact of the free radicals, which can have a negative impact on collagen in the skin and then give us a more worn appearance. And then lastly, dovetailing on what she had to say, just exercise improves circulation to your skin. So all of these things are very important for patients. And once again, I do agree with drinking enough water.
It's so challenging this time of year anyway. It gets colder, it gets dark. You don't want to go out, or at least I don't want to go outside. Spend all my time behind a desk. And these are, I think, great suggestions because it's easy to fall in that trap.
Yeah,
right.
Exactly.
You guys were great. Thank you very much for being on the program. We do really appreciate your time. We're going to take a quick break, and when we come back, we'll have another expert talk to us a little bit about having happy and healthy New Year's resolutions. And welcome back. We have a clinical psychologist joining us for this part of the program. Very excited to have you on, Dr. Deutsch-Anzalone, and we appreciate you being here.
Thank you so much for having me.
Great. Can you introduce yourself to our audience and tell us a little bit about what you do here at Stony Brook Medicine?
Absolutely. So I'm Dr. Veronique Deutsch-Anzalone. I work for the outpatient department at Stony Brook. We are on the university side at Putnam Hall. And my expertise is actually with postpartum and pregnant ladies. I run a group and I see individual clients.
Great. So it's the new year, and we're talking to people about New Year's resolutions and some of the things that they can do to maybe, pave a path forward that is positive for them for the new year. And I want to talk, first of all, because everybody makes New Year's resolutions. Are they ever effective, though?
See, that's a really good question. So this is something that comes up every year with my patients. And what I would have to say is that there's actually 38% is really the percentage of people that actually make resolutions. And unfortunately, about 9% are the people that actually follow through with them.
That's low.
It is low, yes. And actually, most of them actually give up on them the first week of the year, with actually the second Friday of the year being called Quitter's Friday. So the odds are not particularly in your favor with making those. However, if you do make them very specific, then you are more likely to be able to follow through with them. So there are ways to do that.
Interesting. And I'm going to ask you what those ways are, because I think when people, but first of all, I kind of want to know what very specific means, because a lot of people, probably the most common New Year's resolution is, I'm going to lose weight. That seems general, but maybe not.
No, absolutely. That is probably the number one that we hear. 48% of people decide that it's going to be health related. So yes, absolutely losing weight, or that they're going to exercise more, or they're going to get better sleep. But the best way to make it more specific is actually to make it a SMART goal. So SMART stands for specific, measurable, attainable, relevant, and time-based.
Interesting.
So when my clients come to me and they're, the first week of the year, and they say, Dr. V, that's what I go by, Dr. V, because my name is very long. They say, I want to lose weight, or I want to go to the gym 10 times during the week, or, something that I feel like is very unrealistic. I usually say, whoa, wait, let's slow down. Let's try to pick one thing, and let's try to go through each letter in SMART and, make it very specific. So we will be talking about mindfulness later. Mm-hmm. That seems to be a goal that a lot of my clients want to do. So if we were to break that down, the S would be specific. So wanting to engage in more mindfulness throughout the year. M, measurable, would be deciding to do it 5 times a week. Attainable, is that attainable for my clients? Yes, they could probably make it to 5 times a week if they start maybe with once a week, and then twice a week the next week, maybe 3 times a week the third week. Then relevant, is it relevant for them? Yes, it's good coping technique. And then time-based is kind of what I was saying before, is that you could start with once a week, then maybe the second week they do it twice a week, then the third week 3 times a week, until eventually they're doing it 5 times a week.
I really like your advice on the SMART goals. To me, that makes all the sense in the world, and attainable to me is so important, because I think a lot of times people will just make these large, like you said, overall goals. They're not very specific. I'm going to lose a lot of weight. Well, how about you lose 5 pounds by the end of March, or something like that makes sense. That to me seems much more logical.
Yes, a lot more logical, and a lot of people have many New Year's resolutions, and if you're very black and white like that and have many goals at first, then you're more likely to give up on all of them.
That makes sense as well. Let's talk about realistic goals, because I think that's kind of what you're getting at. And when people make that long laundry list of goals, as you said, that's really difficult. And you're really putting a lot of pressure on yourself, which we already have a lot of pressure on each one of us. We don't need to do it to ourselves.
Absolutely.
So pick maybe one key thing and then kind of try to stick with that. Is that what you're advising?
That is usually what I suggest for my clients, because they are so gung-ho in the beginning of the year, which makes sense because for everybody, the new year is that new beginning, that fresh start.
Yep.
Hence the reason why a lot of people want to start with those New Year's resolutions. And it's great. I don't want to take that motivation away from anybody, but I do want to be realistic for them as well.
So, Dr. V, we just did a program on the holidays and surviving the holidays. It's a stressful time, I think, for a lot of us. And when you're setting these goals and you're putting these stressors on yourself, it's also a difficult time. What are good stress management techniques for people?
So there's a lot of different ways that you can handle your stress. First of all, we were just talking about all of these wonderful resolutions. There's trying to eat healthy. There's trying to get some exercise into your schedule. The CDC recommends 150 minutes a week. That could be spread out any time that you want. So that could be 30 minutes several times throughout the week, or it could be, one gigantic block during one day. Hopefully not. Sleep hygiene is a really important thing. So getting at least 7 to 9 hours of sleep is really important. Then we have our skills that we teach in individual therapy. So mindfulness practice is one of those. We also teach progressive muscle relaxation and imagery. One of my expertise is cognitive behavioral therapy. So we teach how to cognitively restructure our thoughts. So that's basically identifying stressful triggers in your environment and recognizing that there are thoughts that we have that we call automatic thoughts that are negative, that we have zero control over, and that they fall into these maladaptive patterns of thinking that we call cognitive distortions. And recognizing that when we have these patterns of thought, that it's not so healthy.
Yeah.
And that when we realize that we do this, there may not be so much evidence that supports that.
So you mentioned the automatic thoughts.
Mm-hmm.
What would that be? Give me an example of something like just something that pops in your head that's negative, correct?
Yeah, absolutely. So actually, one of the week I work with teenage females, and one of the biggest things that we see is social anxiety.
Yeah.
So say that they need to use the restroom during class. A lot of them won't get up and use the restroom because they're afraid that everybody is going to look at them and judge them. They're going to think that something is wrong with them.
Yeah.
So the cognitive distortion of that is what we call mind reading, where you think that they are thinking something badly about them when actually they don't have any evidence at all that anything is being thought negatively about them when everybody has to use the restroom.
Exactly. And you're creating that narrative in your own mind that's a negative narrative, and it may not be in anybody else's mind.
Exactly. So what we teach them is that is in fact the trigger is, having to get up and use the restroom, and that automatic thought is thinking that other people are thinking badly about you, and recognizing that is the cognitive distortion. And so when we do thought restructuring, we look and see if there's, in fact, any evidence that supports that anyone is thinking that. So what I ask them is, did anyone ever come up to you and say, you're a weirdo. I can't believe that you had to use the bathroom.
Yeah.
And they always say, no. And so we look at the evidence against it. Does everyone else have to use the restroom?
Exactly.
Of course. So then we come up with what we call a balanced thought, which is, yes, people, in fact, need to use the bathroom sometimes. So
that's fascinating. And I like the way you're working through it, because I think that will resonate with, obviously it resonates with people, but, particularly young people, it's tough to think that you stand out, or maybe you're a little different from your classmates or whatever. And that's difficult.
Exactly. So in CBT, we show them the connection between thoughts, feelings, and behaviors. So that's, I'd have to say, our number one coping technique of stress management when in our individual therapy that we teach.
So I really want to talk about mindfulness, because that's something you mentioned earlier, and I think you have some very interesting insights there. So what do you mean, first of all, by mindfulness, and then how can people practice this?
Absolutely. So Mindfulness is the practice of learning to be completely present in the moment on purpose and non-judgmentally. So a lot of people, hear about mindfulness because it's really gotten very popular. It's taken from Zen Buddhism, and it has been around forever. Psychology has taken it up in third wave, and it's become incorporated in a lot of our practice. John Kabat-Zinn is probably the most famous psychologist in mindfulness right now, and that's pretty much his definition of it. Most people recognize it of being present and being aware, but it's really the non-judgment part that people have the most confusion about. And the reason that we teach mindfulness is because there's a lot of judgment in having negative feelings. So when we have something like chronic pain or anxiety or depression, we tend to judge ourselves for having those feelings. And mindfulness is about being able to be present with those feelings and be non-judgmental of ourselves for having them and non-judgmental of others for possibly triggering those feelings and possibly even the world for triggering those feelings. So mindfulness can be practiced in several different ways. There is informal practice where you can have your eyes open and do an activity where we have something like mindful eating, and we'll practice with like a Hershey kiss. And we'll tell them to hold a Hershey kiss in their hands, look at the color of it, bring it up to your nose and smell it, put it up to your ear. People always laugh at that, like as if it makes a noise. And then put it in your mouth and really cherish the taste of it and slowly eat it. Or if something else pleasant, like holding their cat and petting their cat or petting their dog. And we will assign them to do something like that. That's an informal mindfulness exercise. And then a formal mindfulness exercise is more like a meditation where we'll teach them how to do a special kind of breathing called diaphragmatic breathing, where you breathe more from your diaphragm, which is a nice deep breath, and it causes you to kind of relax more, and your eyes are closed. So it's more like a meditation.
And I see you brought something with you.
I did. I brought my chimes just in case we wanted to do one.
I think we do want to do that.
Okay.
Can you walk us through that?
I can. I'll try to do a brief one. So, so let me just show you a diaphragmatic breath. Basically, what I teach my clients to do is you put one hand on your diaphragm, and you're going to take a nice deep breath. So it's like, and you hold it. And then you exhale. So that's the way you're going to breathe. Okay? So I'm just going to walk you through a brief one. And when you hear the chime, that's how you know that it's over. Okay? So you're going to close your eyes, put your hand on your diaphragm. So start by taking a nice deep breath in. And hold it. And exhale. And inhale. Hold it. And exhale. And inhale. Hold it. And exhale. And while you're breathing, I'd like you to just listen to my instructions. I'd like you to be aware of the sense of touch and be aware of how it feels to be seated. Be aware of where your feet are planted and how the temperature feels in the room, and how it feels in your body to be breathing. And now I'd like you to turn your attention to any sounds in the room. There's the sound of my voice. and the sound of breathing. And you might notice that there are thoughts that you might be having in your head. We call these wandering mind thoughts. And I'd like you to be just aware of these thoughts and accepting of them and be non-judgmental, because most people have wandering mind during these exercises. And if you are having thoughts, I'd like you to picture placing them in a book and close the book, place the book on the shelf. And bring your focus back on your breathing. And we're going to take 3 more breaths. And then you're going to hear a chime. And then we're going to open our eyes. So, 1 breath. Second breath. And third.
So I don't know if anybody else did that in the room that's here, but it was very relaxing. I'm looking at the control room too. It was very relaxing.
I'm glad.
I enjoyed it.
That's wonderful.
That was great. We're out of time.
Okay.
That was great, though. Thank you very much, Dr. V, for being here and sharing with us.
Absolutely. Thanks for having me.
And thank you for watching the program. As always, we really appreciate your time and joining us here at Stony Brook Medicine. I wish everybody a Happy New Year.
Stony Brook Medicine is Long Island's premier academic medical center. We transform lives through scientific discovery, education, and care, and we bring together innovative research, advanced education, and extraordinary healthcare expertise to set the standard for how healthy communities thrive. For more information, visit stonybrookmedicine.edu or follow us on social media. Stony Brook Medicine on Instagram, Threads, Facebook, YouTube, and LinkedIn, and Stony Brook Med on X.